they keep raising this whole pay band of 35%, which makes the doctors look unreasonable. I always come from this from a point of view that how on earth did it ever get to them lagging 35% behind? There's been, someone that hasn't been on the ball over the past 20 years or so, keeping pay intact with that. But every time we use that statistic, they want a 35% pay rise. They've lost the argument. People just roll their eyes and go, not a chance, or why should they?
Well, I have enormous sympathy with junior doctors because they are underpaid. But as you say, this is 30, 40 years in the making. They've been used as dog's bodies for a long time. They have to move jobs every 4 to 6 months. They have to move house very often. They have no job security and a very, very poor career structure. And I think the cost of living crisis has just brought to a head something that's been bubbling away for a long time and should have been dealt with, as you say. Having said that, I don't think doctors should be seen to be going on strike. I think it brings the profession into disrepute. Doctors are supposedly clever people. They should have worked out a work-to-rule system. I can give you some examples. They should stop doing discharge summaries, which could be done by any person in the hospital, but it's always the job of the junior doctor. There are stories of doctors being called from one ward to another in the middle of an emergency to sign a discharge summary. And a story today of a nurse, a matron, spanking a doctor on the bottom with a ruler because he didn't do that. I mean, doctors are bullied horribly. But having said that, this is now 5 days strike. It will harm patients. And my point to junior doctors is if you want to go on strike, you must acknowledge that is going to harm patients. The argument that, oh, well, the health service is so bad anyway, we're trying to improve it, that doesn't hold water with me. This is damaging patients. This is 5 days of cancelled operations, cancelled appointments, and I think it's bad for patients, and that's my major concern here.
And will it actually move the dial as well? I mean, it's certainly going to be difficult for patients. It's going to make waiting times longer. It could possibly bring the NHS to an end, arguably, because it just seems to be unsustainable and this is only going to make it worse. But will it actually achieve anything, these strikes?
I think that's a very good point. This is now 15 days of junior doctor strike, and I think it actually hardens the government's attitude because of its apparent irresponsibility. Bear in mind, after these 5 days, there's going to be a 2-day break, and then the consultants are going on strike for 2 days, which means more cancelled operations, and it will lengthen waiting lists. And I think that although the public are generally very sympathetic to doctors for understandable reasons, I don't think the government feel minded to move. Having said that, we see that in Scotland they settled for a figure that was less than half of 35%, and I'm hoping that common sense will prevail and we can achieve that over the next few days.
Right, well, give us a figure. 35% is the ideal. I think we're all agreed it ain't going to happen. 5% is what's being offered. I think the doctors are saying that's not a credible offer. Where do you think it's got to get to, as Isabel says, shift the dial?
I think the figures in Scotland are something like 6-7% this year, but a larger amount next year, and that buys some time for the government to get inflation under control. So it will be wrapped up as a sort of 15% in total, perhaps divided half now, half then. I think that sort of figure, which the BMA have accepted in Scotland, that's what I would hope would cause a resolution to this dispute.
Well, that sounds positive. I mean, certainly from what the papers are saying this morning, there is a crisis meeting going on between the Prime Minister and the Treasury today, with 6.5 being the figure that is possibly being touted. If that gets approved, maybe we'll see this all come to a head. Always good to get your views. Thank you very much indeed for speaking to us. Dr Laurence Gerlis from Same Day Doctor, a private practice. We appreciate your time.